too.
Are you trying to
So
video
the
it?
top off the third. Yeah, there we go. Let's pretend that's like that. Okay, what do we got?
Celiac.
The cranial mesenteric. Caudal mesenteric.
Caudal mesenteric. Then we go from, take each of those and then follow the tributaries and kind of break it down so that you can understand which vessels are attached to whom. Starting with,
Where's that one going?
okay, if you look in here like this, first two come off here. This bottom one we can't see, so we'll get back to that. This one is going where?
The stomach?
If you look up in here, it's going to the lesser curvature of the stomach right in here.
The gastric.
So that's going to be the left gastric. It's going to the lesser curvature. This one kind of splits up, but it's all considered the same. It all goes up here. To what? To the spleen, so that's the leonic. And then some continue past the spleen and go through the greater omentum here, over to the greater curvature of the stomach, right through here. So there are several branches of that that aren't really well labeled or injected, but they all run across here. So that's the left gastroepiploic, or those are the left gastroepiploic. Okay. Left gastric, lesser curvature, left gastroepiploic, greater curvature. Then we're going to have similar arteries going to the right side, the right gastric and the right gastroepiploic. Now, if we go back to the one we skipped, the first one, usually it's the first one, here they're coming off almost the same, but usually the first one off the celiac is going across dorsal to the stomach, and is going to go up towards the liver, and that's the hepatic. And it always gets lost in here because it runs up by the lesser omentum, and you can see it where my forceps were, right here. Okay. Now at the same time we can see this one that comes off with it, and you can see how that's distributing to the lesser curvature in there. This was the left gastric that we saw before. And this is the hepatic. And generally it runs up to the liver, up in here, and it's going to supply blood to the liver, hence the name. And I'll get back to that in a little bit. That hepatic artery is supplying oxygenated blood to the lobes of the liver. The liver also gets a lot of blood from the hepatic portal that we'll see in a few minutes. That blood is oxygen poor, but it's rich in nutrients from the gut. So the liver the cells in the liver get oxygen from the hepatic artery, and they get nutrients from the hepatic portal, and they store those nutrients or package them to send them to the rest of the body. Anyways, the hepatic comes up here and goes to the liver. And this one might have been kind of torn up a little. At the lesser omentum, shred this thing. The hepatic gives off another branch. The main trunk goes to the liver, and then another branch comes back towards the stomach and duodenum. And that's the gastroduodenal artery. The gastroduodenal artery is named that because it's going to have branches that go off to the duodenum and the stomach. The branch to the stomach, actually there's going to be two that come off usually from the gastroduodenal. One is going to come off and go to the lesser curvature, and this one actually comes off in that lesser omentum up there. This is the right gastric artery. And that right gastric goes to the lesser curvature by the pylorus. There's also going to be a right gastroepiploic, and that probably comes off after that gastroduodenal comes in here. And you can see part of it here. See right here? This artery is coming across to the greater curvature. And that artery, you can see where the gastroduodenal, if we look at it from this view, here's the gastroduodenal coming back. Here's the right gastroepiploic, and here's another one that goes into the pancreas. It forms a little wishbone right there. This one that goes into the pancreas runs right at the border of the pancreas and the duodenum. And that's the pancreaticoduodenal. Now there's two pancreaticoduodenal arteries. One comes in at the pylorus here from the hepatic. That's the cranial pancreaticoduodenal. There's another one that comes into the duodenum back here, and I'll get to that in a moment. That's the caudal pancreaticoduodenal. And those anastomose right up here in the duodenum. So you have both those arteries supplying blood to that part of the small intestine, which is where there's going to be a lot of digestion and absorption occurring in there, and it's really muscular. And so the branches of the hepatic then kind of terminate there. The gastroduodenal splits into the cranial, or at first the right gastroepiploic and then the cranial pancreaticoduodenal. Okay. Now, so we can see the hepatic is going to supply blood to the liver. It's going to supply blood to the stomach, at least on the right side of the stomach, and the first segment of the small intestine. The next one to come off is the cranial mesenteric, or superior mesenteric. And if we kind of get these guys sorted out a little, so we've got the colon running down here, and that comes from the ileum, the last segment of the small intestine, which starts right here. Here's the cecum of the colon. So this is the ileocecal valve. And this is small intestine up here. This is all colon or large intestine down here. Cranial mesenteric is going to come up here, right here, and it's going to give rise to vessels that go to the colon and this area near the small intestine. Unfortunately, those branches come off right here. And in your book, they have ileocolic. Is that the branches off the cranial mesenteric? It's probably back a little farther. You're already at the... not, okay. Cranial mesenteric. Let's go to cranial mesenteric artery. Those are veins. Let's see. Let's
Here it is.
let's just use the schematic I gave you.
The map?
Anybody have that? Yeah. Rather than, because they mix the veins and arteries up in that discussion, and to just follow the arteries and their distribution. If we come off the cranial mesenteric, they have an ileocolic, jejunal, which is actually lots of vessels, and caudal pancreaticoduodenal. Now the ileocolic is going to be this portion here that comes back to the colon and continues along the colon up to the ileal region. And in these guys, they actually have two branches. And this probably, in the cat, this is all part of the jejunal here, jejunal artery, which comes off that cranial mesenteric. In the raccoon, there's kind of an anastomosis, and so the jejunal continues all the way down into the cranial parts of the colon and meets up with the ileocolic. In the cat, I think they're a little more separate. The ileocolic is going to come and distribute to the cranial portions of the colon and the terminal portions of the ileum, or small intestine.
Where is the iliac now?
Not iliac, ileocolic. Right here, you can see this come out right here.
Okay.
There's a branch there, there's another big branch right next to it, and those are distributed all throughout here.
Okay.
And then up in this connective tissue, you can see another branch here, this large branch here that gives rise to lots of little branches that go to most of the small intestine. All of these are jejunal arteries. They're just kind of lumped together, and they fan out through the mesentery. So there's lots of jejunal arteries going to the bulk of the small intestine. And then there's another trunk of this. You look back over here. Just look at it on this side. Another trunk of this, see, this is looking at the cranial mesenteric from the other side. And there's another trunk that comes up here and runs up to the duodenum and then goes into that gap between the duodenum and the pancreas. Most of the pancreas has been removed down here. And it runs up in anastomosis with the cranial pancreaticoduodenum. And that's the caudal pancreaticoduodenal right here. This is caudal pancreaticoduodenal. So the caudal pancreaticoduodenal is going to serve, the kind of the cranial parts of the jejunum and the caudal portions of the duodenum.
Can you point out the duodenum again?
Well, the duodenum's cut open here. That's this part right here. And the distinction's not real clear at the caudal end, but cranially it starts at the pylorus.
Okay.
The pyloric sphincter will be right in here, and so this is small intestine. Continuing down here, usually about to where it starts to curve back up. That's usually how it's defined. And so this would all be duodenum. And so this is all, this right here is the caudal pancreaticoduodenum, going up into the duodenum. The caudal mesenteric comes off down here. It's the last thing to come off the aorta, the descending aorta, before it splits into the iliacs. And it goes up into the mesocolon, and it's going to supply the terminal portions of the colon and the rectum. Okay. Now the veins in this, the veins that are illustrated or labeled, there are two sets of veins in the digestive tract. There is the hepatic portal vein, and then there are also somatic veins or systemic veins. And by far the most prominent are the hepatic portal system. That doesn't get injected in your cats. And so you can't see those. Those are usually just clear tubes or look like just thickenings of the connective tissue. In these, the hepatic portal's been injected. And so the large blue vein that we find here is the hepatic portal vein, which runs into the lesser omentum and up to the liver. Okay, the lesser omentum is the connective tissue that was originally around this that kind of connects the liver with this pyloric region and lesser curvature of the stomach. And the lesser omentum continues down along the lesser curvature of the stomach. Now that includes three important tubes. We've already talked about two of them. The hepatic portal vein that I just mentioned, the hepatic artery, which is carrying blood up from the celiac, and the common bile duct. Those three tubes form the triad of the lesser omentum. And the common bile duct is going to carry bile and other liver secretions down to the duodenum. And you can see that here. This is the common bile duct right here. You can see it coming from the gallbladder. And some people were asking yesterday about the different ducts. The gallbladder connects to that common bile duct through a cystic duct, which is kind of like the neck of the gallbladder. And then if we were to dissect into the liver from here and go up into those lobes, you'd see that there are hepatic ducts going to each of the lobes of the liver. And the hepatic ducts bring bile down to the common bile duct, and that takes it to the duodenum. And when we're not eating, or we're not stimulated to release bile, then there's a sphincter that closes off that common bile duct, and it fills back up through the cystic duct into the gallbladder. Okay, now the hepatic portal vein is going to drain the same structures we just identified, and the names of the veins in general are similar to the ones that we identified for the arteries. However, they're a little different because with the arterial supply, it's coming from three different locations. Those three main arteries we talked about, and so its orientation is a little different. So some of the names are a little different. And so if you look at this schematic, the hepatic portal vein is going to get blood. It's actually formed, in your book, the description of it is it's formed from the cranial mesenteric and the lienogastric. And let me see if there's any of these others that I'm talking about. Well, we'll start with that. It gets kind of confusing because there's lots of branches that come into the hepatic portal. But the two branches I just mentioned, this is the lienogastric right here, and this is the cranial mesenteric vein. These two veins come together to form the hepatic portal vein. So from here on up to the liver, that's the hepatic portal vein. Now the hepatic portal vein also is going to get blood from two areas that we talked about before, this pancreas and duodenum and the greater curvature of the stomach. This tributary is the gastroduodenal vein because it's coming from the stomach and the duodenum. It gets a cranial or a right epiploic vein or right gastroepiploic vein that comes from the greater curvature here, and it gets a cranial pancreaticoduodenal vein that runs along with the artery right at the border between the pancreas and the duodenum. There's also a right gastric vein that's been torn off in here, and that's just a little vein that comes into the hepatic portal vein from the lesser curvature right by the pylorus. Okay, so the key on all of these is going to be, you're not going to have to trace the circuit, the blood flow, because that's where this gets really dicey, because the names kind of switch a little between the arteries and the veins. The key is going to be where these are pinned, what they're coming from, what they're attached to or going to if it's an artery. Look for the structures that they're associated with, the tissue they're associated with. And so like here, gastroduodenal, you can see the branches coming from the pyloric region of the stomach and from the duodenum. And so that's why it's called that. Pancreaticoduodenal, you can see that it's running right along that border between the pancreas and the duodenum, and that dumps into the gastroduodenum. Gastroepiploic is coming from the greater curvature and dumping into the gastroduodenum. Now those other veins that I talked about at the beginning, the large ones that come together to form the hepatic portal vein, are the cranial mesenteric right here and the lienic or lienogastric, it's called in the vein. And that's going to get leinic veins from the spleen right in here. These veins come from the spleen. And those are going to get left gastroepiploic veins from the left portion of the greater curvature. It also gets a left gastric vein, which is coming from the left side of the lesser curvature. That's this right here. And that's why it's called the leinogastric, because it's draining blood from the spleen and from the stomach through that left gastric and the left gastroepiploics. Okay, once we get to the cranial mesenteric, the veins that they have, there should be an ileocolic. Cranial mesenteric just has, they just have in general the caudal mesenteric, which is going to go back to jejunal-iliac and caudal pancreatico-duodenal. And the caudal pancreatico-duodenal, I don't know if we can, oh yeah, we can see that. That's going to be a little one, as you can probably see it better here. Here's the duodenum right here, and this vein that comes up right in here is going to go up along the duodenum and join anastomose with the cranial pancreatico-duodenal. This little vein right here is the caudal pancreatico-duodenal right there. And that dumps into the cranial mesenteric. It also gets a lot of jejunal veins, and in this book they call them the jejuno-iliac veins because they pretty much go, the jejuno-iliac are these right here, and this large vein that comes down, you can't really see it, but it comes down here, that's going to get branches all the way to the colon, really. See how it anastomoses here? It goes all the way down to the cranial parts of the colon. And so it goes to the jejunum and to the ileum, to the small intestine. And then there's a caudal mesenteric vein, which is this portion right here.
So those two kind of like run together? Like the cranial and caudal mesenteric?
The caudal mesenteric vein dumps into the cranial mesenteric vein.
Okay.
And they're called that because the caudal mesenteric vein is draining the area supplied by the caudal mesenteric artery. And so that's where the blood supply all going up toward the liver, and the arterial or the venous supply going up toward the liver, and the arterial supply coming up from the aorta at these three spots. That's where it gets confusing because they give the vessel the same name even though it's going away from the caudal mesenteric artery.
That'd be a bad one to put on the exam.
This one right here?
Right. That's a request.
So noted.
Thank you.
It'll be there. Okay, so chances are, I mean, with the jejunal, it's pretty easy because if they're going to be here, you know, and if you call that a jejunal vein, or if you call those arteries jejunal arteries, those would be pretty easy. The others, I'm going to try and have it clear so that you can see the relationships. And one nice thing about this prep is that you can lay these out and you can see all the way from the hepatic portal vein down to each of those terminal venous branches. Same thing with the arteries. With the arteries, I would want to have it exposed so that you could see that which branch is coming off the aorta. And if it's one of those branches, you'd be able to see where that particular branch is going. And you could pretty much guess the name by the structures it's associated with. And by then I'll be so despondent over the scores that I give you credit. if you have the correct first letter to the organ that it's going to.
I'm gonna remember you said that.
Yeah, it's on tape.
Yeah, I got on camera. This is documentation.
First letter, that's all we gotta have?
First letter, awesome.
Not you guys.
Ah, brutal.
Okay, that's the guts.